DRC and is based in Bunia. Alex, thanks very much indeed for joining us. Welcome to the program.
Hello, thank you, thank you.
Maybe you can start by giving us an update on the situation in Bunia. How would you describe the outbreak at this stage?
At this stage, the outbreak remains very concerning. We see the number of suspected cases as well as the number of confirmed deaths flying right at this time I am speaking. We really need to scale up our response, which the IFRC is now doing to contain the virus as much as possible, since it's now spread in 5 provinces in the country.
So, when you say scaling up your response, what does that mean in practical terms? And where are you concentrating these efforts?
We have now some areas that are not prepared at all to face the disease. We need to scale up the response. That means supporting the Red Cross teams that are already here. You know, those guys are community members, but they need material. They need, for example, vehicles like ambulances. They also need the proper training to be able to face the disease. And also, they need the proper training to go with the community, talk with them, and spread the life-saving messages we really need. In practical terms, we are revising our emergency appeal to 65 million Swiss francs. This will allow us to get the proper material to support the National Red Cross, the DRC Red Cross, and also to reach about 9 million people.
One of the latest developments, I believe, has been the arrival of additional safe and dignified burial kits. Why are these supplies so important in controlling Ebola?
These supplies arrived at a moment where our stocks were running dangerously slow. As you may already know, even after death, the body of someone after Ebola, after death from Ebola, remains highly contagious. This is why the body needs to be handled properly. We have now 400 volunteers, community members who are handling safe and dignified burials in the 5 regions, but they need material. This support gives us a critical breathing room, but given the scale of the crisis, international attention simply cannot afford to drop. And we now call for a free flow of humanitarian cargo as well as the support of our emergency appeal.
So the outbreak's now spread across 5 provinces. How concerned are you about the risk of a further spread, both within the DRC and also into neighboring countries?
The risk is real. This is why we need to keep up the deployment of every effort. We cannot lesignate any effort. We now are concentrating our effort in the 5 regions. This is put in place with 5 very main pillars, but I will mention the community engagement one, which is life-saving information we need to spread all over the community for them to protect themselves, because in such an epidemic, community members are not just beneficiaries. They need to be considered as active responders. We have also focused on the early detection. We now know that this virus has been detected very late. This is also a reason why it is spreading in the community this way. We need to focus on the early detection so that every person who presents a suspect symptom can go and seek the proper care needed. And also, we have such activities to break the chain of transmission, like safe and dignified burials. These efforts cannot be done without the support of all of our partners, which are other humanitarian organizations, but also our donors. But more importantly, these efforts cannot be implemented without the support of the community itself.
So, beyond medical care, what are the biggest humanitarian challenges that families and communities are facing right now?
We still see a lot of rumors and misinformation spreading even faster than the virus itself. This is one of our main challenge. I remember speaking to a young man. He was 27-year-old. His name was Claude. He told me that he know nobody who went to a Ebola treatment center and came back home alive. This is one example of the perception the community has. Uh, while in another hand, we now know that more than 600 people had survived from the virus. There are a lot of information going everywhere that can fuel mistrust and prevent people from seeking early care. This is a challenge we need to address, and this is also why we deployed more than 1,000 volunteers, community members, to go door to door, speak with the community, listen to their concern, and spread the life saving information we really need to be spread in the community right now to face the disease.
Your teams are also calling for faster customs and cross border clearance of humanitarian supplies. What impact are those logistical delays having on your responses?
Yeah, you know that international logistic is a challenge. This is not a news for nobody. But in such an emergency situation, we plead for a free flow of humanitarian cargo because every supply, every material we receive is aimed at saving lives. Any delay can maybe put in threat community members and even ourselves.
Is there anything that's giving you confidence that this outbreak can still be brought under control despite this recent spike in cases?
I will be honest with you. The situation remains highly concerning. The positive thing is we are here. We humanitarian actors are here to support the community. We are doing our best. Myself, it's now 2 months, exactly 2 months I've been deployed in the DRC. I think the situation worsening and worsening. But yeah, we keep up doing the job we have to do. This is such an obligation for us. And yeah, we don't see how things are going, but we keep confident that keeping up the good work, speaking with the community, trying to reinforce the early detection and also put in place our pillars in order to break the chain of transmission can make a difference, maybe in the next week or in the next months. That's a
Res-
hope.
Responders like you and healthcare providers must be at risk this whole time. Tell me a little bit about how difficult it is to be able to do your job in such an environment.
Uh, we need to observe ourselves the prevention measures. I mean, I wash my hand on a regular basis. I check my temperature at least twice a day, and I do my best to respect the distance, the distancing. But yeah, we are still at risk, and since there is no vaccine or no specific treatment, um, all we have to do is to act like we are preaching the community to do, trying to do our best to protect ourselves. This is mainly, this will be mainly the prevention measures.
And finally, what support is the IFRC appealing for from the international community? And what's your message you'd like to leave with the people in the affected communities?
Our emergency appeal have now been revised upwards. We really need support to implement our 5 pillars that are the safe and dignified burials, the community-based surveillance for early detection, the risk communication and community engagement, as well as the infection prevention and control towards the health workers and the mental health and psychosocial support. This revised appeal aimed at protect and save 9 million people.
Alex, we're going to have to leave it there. Thank you very, very much indeed for joining us. And we wish you and your team the best in the good work that you continue to do.
Thank you. Thank you so much.
That was Alex Locke, spokesperson for the International Federation of Red Cross and Red Crescent Societies. speaking to us from Bunia in the eastern DRC. Right, let's turn to this story. South Africa is seeking to deepen its energy partnership with China as it looks to attract billions of rand in investment to modernize its electricity infrastructure and support the transition to cleaner energy. Electricity and Energy Minister Dr. Josienzo Ramkgopa is leading a high-level delegation to Beijing for the South Africa-China Electricity and Energy Investment Conference, where government officials will present investment-ready projects and hold talks with Chinese partners on financing, technology and infrastructure development. Channel Africa's economics reporter is Innocent Simosa.
The South African government is stepping up efforts to attract foreign investment into the country's